It's my pleasure and honor for the first time in White Coat to have Dr. Rodolfo Ray. Welcome, Dr. Ray, to White Coat.
Good morning. Thank you. It's a pleasure to be here.
It's a very important topic. Sometimes it's misdiagnosed in like a lot of communities. A lot of women do not recognize the dysfunctional uterine bleeding. They have it just as heavy menses or whatever. So in the beginning, we kept saying dysfunctional uterine bleeding. What is dysfunctional uterine bleeding? Does it come in early age, late age? Is it related to certain age in women?
Yes, thank you. So in particularly with the terminology of dysfunctional uterine bleeding, it has been recently replaced by the terminology of abnormal uterine bleeding in the United States. In 2011, the International Federation of Gynecologists and Obstetrics, in an attempt to try to describe some of these symptoms, there was a lot of different terminology being used in the literature. So to standardize the nomenclature, they suggested this terminology, basically to describe any kind of menstrual bleeding that is outside of the normal range. The normal range in terms of volume, duration, regularity, and frequency.
Okay. You said it's either a change in the volume, because I want to I want to repeat those terminologies so people would understand what we're talking about today. Change in volume or?
Yes. So anything that falls out of the normal range, which we're going to go into, but the four different characteristics that one should look at is the volume of the menses, the duration, the regularity, and the frequency.
Okay. So four things, if any of them are changed, we consider it abnormal uterine bleeding or dysfunctional.
Correct.
Is it related to certain age in women?
Yeah, usually usually it's caused by this hormonal disturbances in the hypothalamic pituitary ovarian axis, which usually can be seen early in age when the hypothalamic pituitary gonadal axis is still a little bit immature, and then towards the end, closer to the perimenopausal stage.
So it's related more to hormonal imbalance, can we say that?
Yes, in particularly this nomenclature that is called dysfunctional uterine bleeding has been replaced by abnormal uterine bleeding due to anovulatory problems.
Okay.